Universal health coverage in Cambodia, a success in the making and the unfinished agenda. The World Health Organization defines universal health coverage as when all people can obtain the health care they need without risking financial hardship. This is enshrined in national development strategies. It is a goal towards which Cambodia is steadily moving. What does universal health coverage really mean? How can we measure it? 3 dimensions together allow us to better understand where we are on the road to universal health coverage. Population, services, financial protection. Population. Who is covered? From a few to many, and from many to all. When coverage is truly universal, everyone has access to it. Services. Which services are covered? From the most basic to the most advanced, not only in terms of quantity, but also quality and equity of access. Financial protection. How much do people have to pay out of pocket? And how much of it is prepaid through some form of health insurance? These 3 dimensions come together and a cube is formed. How full the cube is the degree to which we have achieved universal health coverage. Let's use this model to look at the past 20 years of health policy in Cambodia. The major step forward was the introduction of Health Coverage Plan in 1996, which established and equipped operational districts across the country. The introduction in 2000 and expansion thereafter of health equity funds has been a unique feature in Cambodia. Other various community-based schemes allowed to improve coverage in the informal non-poor segment. The midwife incentives improved access to antenatal care and delivery in health facilities. The implementation of Health Strategic Plan and a new health financing policy are other important milestones on the way to universal health coverage. A lot has been achieved, but there's still much that can be done. What do we know from around the world about the key determinants of achieving universal health coverage? We know that there can be no universal health coverage without solidarity, both within and beyond the health sector, ensuring that no one is left behind and that care is provided for all. There can be no universal health coverage without efficiency, making sure that we get the most out of the money invested in health. There can be no universal health coverage without awareness, people being aware of their own health and demanding high-quality services. There can be no universal health coverage without rule of law, having rules and regulations which are enforced and promote fairness and equity. If these principles are consistently promoted at all levels, significant gains towards universal health coverage will be made. In order to make it a reality, what are some options available to policymakers? One way would be to extend financing mechanisms such as health insurance and health equity funds to cover the near poor, particularly vulnerable groups, including children, older people, and the disabled. Another focus would be to ensure services are of the highest quality by investing in health education and licensing and accreditation. By promoting health insurance schemes to reduce out-of-pocket health expenditures and improve efficiency and transparency. Why focus on it now? Because achieving universal health coverage is possible within a generation. Because universal health coverage will benefit not only Cambodia's health today, but ensure its prosperity, stability, and well-being in the future.